Top of the morning, Dan, Ann, Amy, and HHS Secretary Alex Azar yesterday at the Coronavirus Task Force briefing gave us an update on testing as well as, stockpiling medications that have that could be a prospective antiviral therapy.
As of today, 20 different emergency testing options, with the FDA responding to requests for authorization typically within 24 hours. The number of options is growing nearly every day. FDA has also opened up new options for using the available tests, like self-swabbing, and new options for reagents. I also want to thank FDA and other components of HHS for incredibly rapid action on other tools that we need. This weekend, we actually worked to secure 30 million tablets from Sandoz and 1 million tablets from Bayer of hydroxychloroquine and chloroquine, which are potential COVID-19 treatments, and we authorized Battelle's new decontamination machines, which can each sterilize thousands of essential N95 masks for reuse every day.
Let's pick it up right there with Dr. Jerome Adams. He is the United States Surgeon General. Dr. Adams, thanks so much for joining us. Appreciate it.
Good morning. Glad to be here.
Let's start with the antivirals that Secretary Azar mentioned. One is since there's 1,100 trials going on per President Trump the other day with respect to the hydroxychloroquine plus the Z-Pak, the prospect of that coming online beyond the FDA-approved emergency use, and then what else is in the offing? I've heard that there's as much optimism about remdesivir as there is the hydroxychloroquine plus the Z-Pak.
Well, there are literally hundreds of trials going on around the world right now looking at different therapeutics. And as you mentioned, the most promising ones are remdesivir, and also, which is a Gilead drug, and then hydrochloroquine and chloroquine, which are anti-malarial drugs that are also in some cases used for rheumatologic diseases. But it's important for people to know that we've got a long-term timeline. We're looking at about a year out, or next year, for vaccines. We're looking at weeks to months before we feel good about a therapeutic. And then right now, what we're really helping people understand is that historically, when you look at these types of diseases, the way that you stop the initial surge, the initial go-round, is with basic public health measures. I put a tweet out on this morning. It's what your mother told you all along. Wash your hands, keep your hands to yourself, and stay away from strangers. And really, that social distancing and that good hygiene is what's going to get us through this initial surge and buy us some time so that we can get some better therapeutics out there and treat people.
That's fair enough, and I just want to pick up on the weeks and months with respect to the antiviral therapies, because President Trump on Sunday evening at the briefing essentially picked up on a position that others have taken, including in the medical community, that maybe we need to move away from safe and effective to safe as the standard to bring an antiviral online and get FDA approval in this context.
Well, we are in crisis mode right now, and the simple truth is that if one of my loved ones was in the hospital with COVID, I would want to have a discussion with a physician about all options being on the table. And so we want to make it possible from a federal point of view for that conversation to be able to be held. But we also owe it to the American people to not just blanketly say, hey, we're going to accept that this is an effective treatment, because there are real problems with drugs. Every drug that we give someone can save your life, or it can kill you if given to the wrong person for the wrong reasons. And so we feel better about the safety of hydroxychloroquine and chloroquine because they've been on the market for years, but that doesn't mean that they are without risk, and it doesn't mean that they're effective. So we're going to make them available, and we're going to collect the data so that in a few weeks to months, hopefully we can tell people, look, this either does or doesn't work, and it is either safe or not safe in these array of populations.
If you do see promising results like you have with the drugs mentioned, with remdesivir or others, will you stockpile those the way that HHS reported you're stockpiling hydroxychloroquine and chloroquine?
Well, absolutely. We will, if we find something is promising, and we are looking at the data day by day, literally hour by hour, and we're also being proactive. We're not waiting. We're working with companies to increase manufacture. We're stockpiling where appropriate. One of the challenges with stockpiling is you've got to realize these drugs were designed originally for other purposes and other people.
Right.
And so you don't want to pull so much away that you actually hurt the people who need them at the current moment. But we're thinking through those things right now so that if we find out that this is effective, we can immediately say to people, hey, we've got plenty of supply, and doctors go forth and prescribe.
Dr. Adams, you mentioned this is the first wave. When will we have a second wave and possibly a third wave? And will we have to be exercising social distancing during those times as well?
Great questions. And the fact is, we look at what's happened with past respiratory diseases. We also look at the fact that this disease is spreading now in the southern hemisphere. And that makes us feel like this disease might come back again. I say might because we don't know. It's the first go round. But if it does come back, we will be much better equipped because we will have better testing. We'll have better public health capacity to do contact tracing. We'll hopefully have antivirals and therapeutics available, and we'll have a vaccine. And so hopefully if it does come back, it will be much more like the traditional flu or other diseases which we deal with on a common basis and don't cause us to have to shut down the government or do intense social distancing.
I was speaking with a doctor here at Loyola in Chicago, and he brought up an interesting point talking about the spread in high density areas like New York City and some other urban centers. And he talked about people living in apartment buildings, condo buildings, multifamily units, and that the ventilation systems in those buildings is such that it doesn't prevent the spread of the virus within the buildings. It's actually not like an airplane, for example, where the air is circulated out, that you can have somebody who's infected, and I live in a condo building, by the way, on the first floor, and it can travel through the ventilation to the fifth floor, and maybe in high-density areas where a lot of people live in multifamily housing, that's one of the ways it's spreading. Does that jibe with your with you?
Well, first of all, Loyola, great school. I actually matched there for my residency. I don't know if you all know, but my family and I have lived in the Midwest for the last 25 years before I became Surgeon General. But I asked this question specifically of Tony Fauci, and here is the answer he gave me. Tony Fauci, top virologist in the world, said that when you look at COVID-19, we still believe that the majority, and when I say the majority, I mean the large majority of this spread is by droplet transmission. Droplets only travel so far. They only and that's why we have these social distancing guidelines. They travel just a couple of feet, and there is literally no evidence we found so far that this virus will get aerosolized to the point that it can go through ventilation systems. So right now, there is no evidence out there to suggest that this particular disease will travel through ventilation systems and harm people. The most effective means of it transmitting is by people coughing or sneezing on each other, or by it getting on surfaces and then people touching those surfaces and then touching their face or their hands or their mouth or their nose.
Okay. I haven't touched my face in weeks, just so you know. And there you go, Dan. That's a great answer. I mean, for you that lives in a condo.
Well, a lot of people do in Chicago,
a lot of people
obviously.
Do. Right.
Yeah.
The CDC considers recommending general public wear face masks in public. How do you feel about that?
Well, the CDC actually hasn't changed their recommendations. The WHO and the CDC have both said at this point they do not recommend it. We see it happening in other countries, and here's what people need to understand. Right now, the preponderance of the scientific evidence says that face masks are not effective in preventing the general public from catching COVID-19 as individuals. What we do know is if people are sick and they wear a mask, then if they cough or they sneeze, those droplets aren't going to go 5 feet, 6 feet out, and it can prevent transmission of disease. And that's why we tell, and the CDC and WHO recommend this, they recommend that people who are sick wear these masks. We know there's a real potential downside if everyone goes out there and starts buying surgical masks, because there's PPE shortages among healthcare workers, and we want to make sure healthcare workers can get them if we need them. We're following the evidence every single day with more and more cotton masks and cloth masks being produced by manufacturers. We may decide that in certain areas where there's large amounts of community spread, we suggest to people that more people wear these cotton masks. But for the surgical masks, the traditional surgical masks, we want them reserved for healthcare workers. And right now, there's not a lot of evidence. There's actually very little evidence that the net benefit is greater than the harm to the individual wearer. There's also concern, and you've heard Dr. Fauci mention this, about people touching their face more frequently when they're wearing a mask. and actually potentially increasing their risk of getting COVID-19. So for the individual, there may be harms to this that we don't know about. There's not a lot of evidence to suggest it protects you as an individual. There is evidence to suggest that if you are sick, that it can prevent you from transmitting to others. And there's a downside if we tell everyone to go out and get a mask, because then healthcare workers can't get them.
President Trump was asked about this roadmap back to openness that Dr. Scott Gottlieb put out, former FDA director. And in that document, he suggests that the trigger to start reopening, one of them, and the key one, to start reopening society effectively, is having a handle on all those infected and their status, as well as the contact tracing piece of it, and having a handle on all those they've come in contact with. So if that is the theory under which the administration is operating, when do we move past testing with respect to just those presenting symptoms and do the testing of those people, do the contact tracing, the testing of those people with whom they've come in contact?
Great question. I talk to Dr. Gottlieb all the time, and I agree with him here. I agree that when you look at diseases like measles and tuberculosis, we don't shut down the entire city, but we don't do that because we're able to test for them, and then we have teams of people who we send out to follow up on them aggressively and follow up their contacts so that we can isolate them and ensure they aren't going to spread them to others. Important to know that we've done over 1 million tests, over 100,000 per day now, and we also now have a new Abbott test that returns results in 5 minutes. So testing is rapidly ramping up. We want to get to a place where we have good surveillance numbers. And what does that mean? Well, when you look around the country, South Korea initially tested about 1 in 200 in their initial surge. For us, that would be 1.5 to 2 million people, and we are at 1 million people right now. We're continuing to ramp up. We'd really like to get to a place where every county, every place around the country can say, look, we've tested a certain amount of people, 1 in 100 of our population, and we feel pretty good, the same way we do with flu or anything else, that we've got a low-lying rate, and that when people have symptoms, we can chase them down, we can isolate them. And so I expect and hope that we will get there within the next couple of weeks based on how rapidly our ramping numbers have been testing up. But in the meantime, we need everyone to act as if they have the disease, and that means stay at home and especially stay away from people who are older or who have comorbid conditions like heart disease, lung disease, kidney disease, diabetes, so you don't spread it to them.
Dr. Adams, currently there's 164,000 cases in the U.S. Do you know how many of those are active cases, or how many people are in the hospital or under some home confinement? Is there any way to get that data?
Well, hopefully every single one of those cases that's been diagnosed is isolating. We know that a couple of important things. We know that about 80% of people actually are just fine, even when they've been diagnosed, and can stay at home and quarantine for 14 days until they have negative tests. So that's 80%. 20% end up going into the hospital. Of that group that ends up going into the hospital, we know the lion's share of them still recover. We know that from the data around the world, 98 to 99% of people fully recover. And so everyone's going to be on a different timeline based on when they get the disease. But important to know that most people are going to have mild symptoms. Of the people who do end up getting diagnosed, most of them are still going to recover. That's why we're so focused on protecting the most vulnerable out there, and also focused on flattening the curve so that we don't overwhelm our healthcare systems.
He is Dr. Jerome Adams. He's the Surgeon General of the United States and a Midwesterner. We're happy to hear that.
Yay.
Dr. Adams, thank you so much for joining us. Really helpful. Appreciate your time.
Thank you, and go to coronavirus.gov or the Illinois Department of Health website for more up-to-date information. And you can also go to apple.com/COVID-19. It'll walk you through symptoms so you can determine whether or not you need a test.
Great. Thank you very much.
Thank you. Dr. Adams, U.S. Surgeon General of the United States, joined us on our turnkey.pro answer line.
Listen to podcasts of Dan and Amy from the AM 560 mobile app. Download it today at 560theanswer.com/mobile.
Don't you love that feeling when you just nailed your look? When someone you barely even know comes up to you and says, "Oh,